Over the years, humanity has faced countless diseases, some so devastating that finding a cure seemed impossible. Today, I'm going to show you the 15 most terrifying diseases of all time and how they have impacted our society. Before we begin, we're on our way to reaching 100 subscribers. Help us get there. Let's get started. Bubonic Plague. The bubonic plague was one of the most devastating pandemics in history. In the 14th century, this disease wiped out approximately 200 million people, ravaging Europe, Asia, and North Africa. It was caused by the bacterium Yersinia pestis, primarily transmitted by fleas that infested rats. The disease reached Europe through trade routes, such as the Silk Road, and spread rapidly, wiping out entire cities. Symptoms began with high fever, intense sweating, and the appearance of dark boils on the skin, known as buboes. Without treatment, these symptoms would progress to necrosis and the release of fatal toxins in the body. With a mortality rate of over 70% at the time, the bubonic plague not only caused mass deaths but also reshaped society. The church, for example, lost influence as countless clergy members died while caring for the infected. Additionally, economic and social changes were inevitable as the labor force was drastically reduced. Ebola. Ebola is one of the most terrifying diseases of the modern world due to its high mortality rate and devastating symptoms. First identified in 1976 during outbreaks in Sudan and the Democratic Republic of Congo, it was named after the Ebola River near one of the initial cases. Fruit bats are considered the natural hosts of the virus, which can be transmitted to humans through contact with bodily fluids or contaminated materials. Depending on the strain, the mortality rate can range from 25% to an astonishing 90%. Early symptoms are similar to the flu, such as fever, muscle aches, and fatigue, but they quickly progress to nausea, diarrhea, and internal and external bleeding. The rapid deterioration makes it a true nightmare for both patients and caregivers. The largest recorded outbreak occurred between 2014 and 2016 in West Africa, causing over 11,000 deaths and creating global panic as it spread to the United States and parts of Europe. This event highlighted the urgent need for better international preparedness in public health crises. Although there is no definitive cure, advancements have been made in treatments and vaccines to better control future outbreaks. Smallpox was one of the deadliest diseases in human history, causing millions of deaths over the centuries. Caused by the variola major virus, the disease was highly contagious, transmitted through respiratory droplets or contact with bodily fluids and contaminated objects. Symptoms began with high fever, headaches, and weakness, followed by skin rashes that developed into pus-filled blisters across the body. These lesions, upon healing, left deep and permanent scars. In severe cases, the mortality rate reached 30%, and in infants, this number was even higher. Smallpox had a devastating impact during the colonization of the Americas, where it was introduced by Europeans. Indigenous populations, lacking natural immunity, were decimated, drastically altering the continent's demographics and history. However, a significant breakthrough in medicine came in 1796 when Edward Jenner developed the first vaccine, using the cowpox virus to protect against smallpox in humans. This discovery marked the beginning of the vaccination era. The fight against smallpox culminated in 1967 when the World Health Organization launched a global eradication program. The last natural case was recorded in 1977 in Somalia, and in 1980, the WHO officially declared the disease eradicated. Spanish flu. The Spanish flu was one of the most devastating pandemics in modern history, occurring between 1918 and 1919 near the end of World War I. It's estimated that about 1/3 of the global population was infected, and the death toll ranged from 20 to 50 million, with some estimates reaching as high as 100 million. Caused by the H1N1 virus, the flu spread rapidly, but contrary to its name, it did not originate in Spain. It's believed to have started in Asia or the United States, but it was called the Spanish flu because Spain, being neutral in the war, was one of the first countries to openly report the severity of the disease. Symptoms included high fever, body aches, severe coughing, and in critical cases, pneumonia, which often led to death. Interestingly, unlike most seasonal flu outbreaks that are more deadly for the elderly and children, the Spanish flu had a devastating impact on young, healthy adults, possibly due to an exaggerated immune response. The pandemic was worsened by the war, which facilitated the virus's spread as soldiers traveled between countries and lived in poor sanitary conditions. The lack of antiviral treatments or vaccines at the time left the world vulnerable, and measures like isolation, mask wearing, and quarantines were implemented to try to contain the outbreak. It wasn't until decades later that vaccines for the flu began to be developed. Tuberculosis. Tuberculosis is one of the oldest and most persistent diseases in human history, affecting people for thousands of years. Caused by the Mycobacterium tuberculosis bacterium, the disease is transmitted through the air, primarily via droplets expelled when an infected person coughs, sneezes, or speaks. The main symptoms include persistent coughing, fever, night sweats, and weight loss. In advanced cases, it can cause severe damage to the lungs and other organs, leading to death if untreated. Although many people carry the bacteria in a latent form, it usually only manifests when the immune system is weakened. Tuberculosis has even been found in ancient Egyptian mummies, but its most destructive impact occurred during the 18th and 19th centuries, particularly in Europe and North America, where it was known as the White Plague. During this time, the disease caused millions of deaths, especially in overcrowded and unsanitary urban areas. In the 20th century, the discovery of antibiotics like streptomycin brought hope in the fight against the disease. However, tuberculosis remains a major global challenge. It is estimated that over 10 million people contract the disease every year, resulting in more than 1 million deaths annually, mostly in developing countries. Poliomyelitis. Poliomyelitis, or polio, is a highly contagious disease caused by the poliovirus. This viral illness attacks the nervous system and, in severe cases, can lead to permanent paralysis or even death. While it is most commonly associated with children, adults can also be infected. Transmission occurs primarily through contact with water or food contaminated by the feces of infected individuals, especially in areas with poor sanitation. Early symptoms include fever, headache, fatigue, and muscle pain. In severe cases, the virus can reach the spinal cord, causing paralysis in the lower limbs and, in some instances, respiratory issues. At the height of the disease during the 1940s and 1950s, polio caused global panic. Outbreaks in the United States, for example, led to widespread social isolation, with schools and public spaces closed, resembling the measures seen during the COVID-19 pandemic. A milestone in medical history occurred in 1955 with the introduction of the vaccine developed by Jonas Salk, followed by the oral vaccine created by Albert Sabin, which enabled mass immunization. These vaccines were crucial in drastically reducing polio cases worldwide. Thanks to global vaccination campaigns, polio has been eradicated in many regions, but the disease persists in a few countries, such as Pakistan and Afghanistan. Complete eradication depends on sustained immunization efforts and vigilance. Cholera is an infectious disease caused by the Vibrio cholerae bacterium, which primarily affects the small intestine. Transmission occurs through the consumption of contaminated water or food, especially in areas with poor sanitation. The disease is characterized by symptoms such as severe watery diarrhea, vomiting, and extreme dehydration, which can lead to death within hours if left untreated. The rapid dehydration caused by cholera is so severe that, historically, victims have been known to lose up to 20% of their body weight in a single day. It is believed that cholera originated in the Ganges River Delta in India and spread globally in a series of pandemics beginning in the early 19th century. During these pandemics, cholera devastated entire populations, causing thousands of deaths in cities like London and New York, where sanitary conditions were poor. Despite being a severe illness, treatment is relatively simple. Oral or intravenous rehydration is the primary method for saving lives. Preventive measures, such as access to clean drinking water and proper sanitation, are also critical to controlling the spread of the disease. Today, cholera still affects millions of people in developing countries, particularly in areas impacted by natural disasters or humanitarian crises. It is estimated that between 1.3 and 4 million cases occur annually, resulting in approximately 21,000 to 143,000 deaths each year. Malaria. Malaria is an infectious disease that remains one of the leading causes of death in tropical countries. It is caused by parasites of the Plasmodium genus, which are transmitted to humans through the bites of infected Anopheles mosquitoes. The initial symptoms of malaria include fever, chills, headaches, intense sweating, and fatigue. In severe cases, the disease can lead to complications such as severe anemia, organ failure, and often death, particularly in children and pregnant women. It is estimated that malaria has plagued humanity for thousands of years, with historical records dating back to ancient Egyptian and Chinese texts. During colonization and the transatlantic slave trade, malaria played a deadly role, decimating indigenous populations and infecting those who lacked immunity. In the 20th century, scientific advances such as the use of anti-malarial drugs and the development of insecticide-treated bed nets helped reduce cases in many regions. However, malaria remains a serious threat, with more than 200 million cases reported annually and approximately 600,000 deaths, primarily in sub-Saharan Africa. A major milestone was the recent approval of the first malaria vaccine by the World Health Organization. Nevertheless, the fight against the disease is far from over, especially due to the growing resistance of parasites to medications and mosquitoes to insecticides. HIV/AIDS is one of the most significant diseases in recent history, both due to the number of lives it has affected and the stigma associated with it. HIV, or the human immunodeficiency virus, attacks the immune system, making the body vulnerable to infections and diseases that would typically be easily fought off. Without treatment, HIV infection progresses to AIDS, the acquired immunodeficiency syndrome, which is the advanced stage of the disease. It is believed that the virus originated in Central Africa in the early 20th century, transmitted from primates to humans. However, it only gained global attention in the 1980s when the first cases were recorded in the United States. Initially, AIDS was mistakenly associated with specific groups, contributing to stigma and misinformation. Early symptoms of HIV can be mild or almost non-existent, but as the disease progresses, the immune system becomes severely compromised, leading to opportunistic infections and cancers that often result in death. To date, more than 40 million people have died from complications related to AIDS. A turning point in the fight against the disease was the introduction of antiretroviral therapy in the 1990s, which transformed HIV from a death sentence into a manageable condition. Today, people living with HIV can have a life expectancy similar to those without the virus, provided they have access to treatment. Despite significant progress, the fight against HIV/AIDS is far from over. It is estimated that around 38 million people are currently living with HIV, and unequal access to treatment remains a challenge, particularly in developing countries. Leprosy. Leprosy is one of the oldest diseases recorded in human history. It is caused by the bacterium Mycobacterium leprae, which primarily affects the skin, peripheral nerves, and, in more severe cases, the eyes and upper respiratory tract. The disease is characterized by the appearance of whitish or reddish patches on the skin, which can result in a loss of sensitivity to heat, touch, and pain. In advanced stages, leprosy can lead to disfigurement, loss of limbs, and other severe complications due to progressive nerve damage. Historically, leprosy was surrounded by stigma and fear, as many believed it was a divine punishment or highly contagious. As a result, those affected were often isolated in colonies or sanatoriums, living in poor conditions without access to treatment. It wasn't until 1873 that Norwegian physician Gerhard Armauer Hansen discovered the bacterium responsible for leprosy, leading to advances in understanding and treating the disease. Today, leprosy is considered a disease with low transmissibility and can be effectively treated with antibiotics, known as multi-drug therapy. Although cases have declined globally, leprosy still affects thousands of people, particularly in regions with poor socioeconomic conditions. Brazil, India, and Indonesia are the countries with the highest incidence. Combating the stigma associated with the disease and ensuring access to early diagnosis remain essential for its eradication. Measles. Measles is one of the most contagious and well-known diseases caused by the morbillivirus. It is transmitted through the air via respiratory droplets released when coughing, sneezing, or talking. This high transmissibility made measles a global threat for centuries, especially before the development of vaccines. The initial symptoms include high fever, coughing, a runny nose, and red, watery eyes. A hallmark of the disease is the appearance of small white spots inside the mouth, known as Koplik spots, followed by a skin rash that starts on the face and spreads across the body. In severe cases, measles can lead to complications such as pneumonia, encephalitis, and even death. Before the introduction of the vaccine in 1963, measles was one of the leading causes of childhood mortality worldwide. It is estimated that millions of children died annually as a result of the disease. Widespread vaccination programs drastically reduced cases and deaths, with many regions achieving the elimination of endemic transmission. However, measles remains a global concern. In areas where vaccination rates have declined, outbreaks have reemerged, primarily affecting children and unvaccinated individuals. Misinformation and anti-vaccination movements in some communities have contributed to the resurgence of the disease in countries where it had previously been under control. Rabies is an incredibly dangerous viral disease caused by a virus from the lyssavirus genus. It affects the central nervous system and is almost always fatal once clinical symptoms appear. Transmission primarily occurs through the bite or scratch of infected animals, such as dogs, bats, foxes, and other mammals. The virus, present in the saliva of these animals, enters the body and rapidly spreads until it reaches the brain. The early symptoms of rabies may resemble those of the flu, including fever, headache, and general discomfort. However, as the disease progresses, it leads to more severe symptoms such as anxiety, mental confusion, hydrophobia, an extreme fear of water, and muscle spasms. In advanced stages, rabies causes paralysis, coma, and death. Historically, rabies was one of the most feared diseases due to its high mortality rate and outbreaks in communities without access to vaccines. Even today, rabies causes approximately 55,000 to 70,000 deaths annually, primarily in regions of Asia and Africa where the vaccination of domestic animals is not widely practiced. The major breakthrough in combating rabies came with the discovery of the vaccine by scientist Louis Pasteur in 1885. Since then, vaccinating dogs and cats, along with post-exposure treatment for humans, has been fundamental in reducing cases. Although rabies is a preventable disease, it still requires caution. Mass vaccination programs and awareness about safe interactions with animals remain essential to prevent new infections. Yellow fever. Yellow fever is a severe viral disease transmitted by the bite of infected mosquitoes, primarily from the Aedes aegypti genus. The disease is most common in tropical regions of Africa and the Americas and has caused devastating epidemics throughout history. Initial symptoms include fever, headaches, nausea, chills, and muscle pain. In severe cases, yellow fever can lead to complications such as liver and kidney failure, jaundice, which gives the skin its yellowish tone, hence the disease's name, internal bleeding, and, ultimately, death. The mortality rate in severe cases can reach up to 50%. Historically, yellow fever was a significant issue during the colonial period, particularly in areas where basic sanitation was non-existent. The fight against the disease began to change with the discovery of its transmission cycle by Carlos Finley, who identified mosquitoes as the primary vectors, followed by the development of a vaccine in 1937. Today, mass immunization and mosquito control are the main strategies for prevention. Although controlled in many areas, yellow fever remains a threat in regions with low vaccination coverage and conditions that favor mosquito proliferation. Avian flu or bird flu. Bird flu is a highly contagious viral disease that primarily affects birds but, in specific cases, can be transmitted to humans. It is caused by subtypes of the influenza A virus, with H5N1 being the most well-known due to its high mortality rate in humans and its pandemic potential. The disease was first documented in birds in Italy in 1878 but only began to raise global concern in the late 20th century when H5N1 was identified in geese in China in 1996. The following year, the first human case was confirmed in Hong Kong, triggering fears of a potential pandemic. Transmission to humans occurs primarily through direct contact with infected birds, their secretions, or contaminated surfaces. Initial symptoms resemble those of the common flu, including fever, cough, headache, and muscle aches. However, in severe cases, the disease can progress to pneumonia, respiratory failure, and death. The mortality rate in humans is extremely high, reaching up to 60% in confirmed cases. Bird flu is particularly concerning due to its ability to mutate and potentially become more easily transmissible between humans. For this reason, ongoing surveillance, culling of infected birds, and control of wild bird populations are essential measures to prevent outbreaks. Although it has not yet caused a pandemic, bird flu remains under close watch by the global scientific community as a potential threat. The development of vaccines and antiviral medications is part of the effort to ensure that, should the virus undergo significant mutation, the world will be better prepared to respond. Asian flu. The Asian flu was an influenza pandemic that occurred between 1957 and 1958, caused by the influenza A virus, subtype H2N2. This virus initially emerged in Southeast Asia, possibly from a combination of avian and human viruses, and quickly spread worldwide, causing millions of deaths. The pandemic began in China in February 1957 and, within months, reached other continents, such as North America, Europe, and Africa, facilitated by increasing globalization and international travel. It is estimated that around 1 to 2 million people died as a result of the disease. The symptoms of the Asian flu were similar to those of a common flu, including fever, headache, cough, and muscle aches. However, in severe cases, the illness could progress to pneumonia, which was the leading cause of death, particularly among the elderly and individuals with pre-existing health conditions. The response to the pandemic included the rapid development and distribution of a vaccine, which was crucial in reducing the number of cases and curbing the virus's spread. Additionally, advancements in treatment, such as the use of antibiotics to combat secondary infections, also played a significant role in saving lives. And those were some of the most terrifying diseases in history. Thank you for watching. If you enjoyed it, leave a like, subscribe to the channel, and turn on notifications so you won't miss more content like this. See you next time.